Hello, everyone, and welcome to our webinar. My name is Mandy Albert, and I am the president of the Greyhound Health Initiative. Today, we'll be focusing on paw pad corns and their causes and treatments, as well as a PhD study investigating the long-term impact on canine gait following tendonectomy treatment for corns at the University of Liverpool. The speakers today are Dr. Mike Guilliard, who first developed the flexor tendonectomy technique, as well as Dr. Carl Bates, biomechanics expert, and Mrs. Williams, Professor Comerford, both providing information on the treatment of corns, an overview of the proposed PhD project, and early results investigating the long-term outcome of corn treatment. Just wanted to tell you a little bit about Greyhound Health Initiative. We are a nonprofit organization that is committed to improving the health and well-being of sight hounds around the world. We build awareness of their unusual characteristics within the veterinary and adoption communities through education, outreach, and research programs. If you would like further information on our research projects or any of the other resources, please visit our website, ghi.vet, and click on Educational Resources. You can also follow us on Facebook and Instagram for the latest educational information or future events. Now it is my pleasure to introduce Dr. Koto, our founder and advisor.
And good afternoon to everybody, and it's great to be here. As I was telling Mandy and Joe and Trina, I am not a big introductions guy, and that's probably all you need to know about me. I fell in love with greyhounds after I adopted my first greyhound, Clyde, and realized that even though he did look like a dog, he was not really a dog. So I spent literally the last 20 years of my life in the university trying to figure out A, how were sight hounds different from other dogs, and B, why were they different? So that led us to do a lot of really cool research from every different angle, from clinical pathology, imaging, hemostasis, you name it. So we spent a fair amount of time doing that. This webinar should be awesome because, as you all know, we deal with corns all the time, and we're never quite sure what the heck to do with them. And I think I may have mentioned this to the organizing committee, who I must thank, of course, for putting all this together. Last year, I did a $12,000 Greyhound corn consult. The owners had already spent $12,000 working up their dog, including a neurologist and a board certified surgeon. And this year I did an $8,000 Greyhound corn. They were actually ready to amputate the dog's leg because he had a quote unquote radiculopathy in the rear leg, and it ended up being just something as simple as a corn. So with that said, I don't think I want to say anything else. I don't want to take time away from the speakers, who again, I thank profusely for participating in this. So I will actually turn my camera off, my mic off, and just watch and learn. So thanks again, everybody, for being here. Thank you, guys.
Thank you, Dr. Koto. I wanted to introduce our board for the Greyhound Health Initiative. A lot of things have changed recently. And if any of the board members are on this recording, if you guys can turn your cameras on if you want to say hello. We have Courtney Kindler, who she co-manages the blood bank with me. And she is currently the secretary. She's been a registered veterinary technician since 2006. She has worked at Riverside Animal Care Center since then. She helped start the blood bank in 2016. And over the years, she has volunteered her time with Team Greyhound Adoption of Ohio and has found many homes for greyhounds. She also helps find us blood donors from her years and years with Team Greyhound. She resides with her family, including 4 greyhounds, 2 Cavalier King Charles, and many chickens. We have Trina, which I know she's here on screen. Trina is our treasurer and our research coordinator. She's been around since the beginning, I think. She's owned greyhounds for 16 years, currently owns 4 retired racing greyhounds, Cody, Lizzie, Bruce, and Bobo, and 1 hound mix, Roxy. She's volunteered with James River Greyhounds for 11 years and currently serves as the adoption coordinator, vice president, and has volunteered with the Greyhound Health Initiative for 5 years. She resides in Richmond, Virginia, and works as a biomedical research administrator with the Department of Veterans Affairs. We have Jo. Jo has been the host of today's symposium. She is our Great Britain representative. She's lived, volunteered, and or worked with greyhounds virtually all her life. She comes from a background in dog welfare charities, working in operations, volunteer management, supporter relations, and marketing, with a keen interest in canine rehabilitation therapies of all kinds. She spends much of her spare time practicing holistic therapies and currently lives with Sergio, a retired racing greyhound. We have Melissa Wolf as our social media coordinator. She lives in Alaska, and she's the founder of local boutiques, Paw Prints, HM Bark, AK Bark. She works part-time for the Special Olympics Alaska and Two Tails Mobile Vet. She says that pets have always been a part of her life. She shared her home with cats, ferrets, saltwater fish, sugar gliders, dogs, and a knoll. Animals are her passion, and sight hounds are her weakness. So she's been helping us out with our social media, which has been really great. We have Molly Wolf, that is our grant writer. She's a blood bank technician. She's been with GHI since 2019. And she says that she's been able to learn about the importance of blood banks for dogs over the past 2 years and love answering the almost guaranteed question, wait, those exist. She is currently she just graduated with her master's from the Ohio State University and enjoys her time spent with GHI. If anybody is interested in volunteering, we are an international charity. We have openings for volunteers. We could use anyone's help who has a special skill, so please reach out to us. Look at our website. We have a general info email. Feel free to volunteer your services if you want to help. I'm going to take it back to Jo, who will start the symposium.
Hello everybody, I'm Mike Guilliard. I pioneered the tendon cutting techniques for the treatment of corns. And in this talk today, I want to talk about corns in general and also the surgical methods of treatment. Okay, so what is a corn? It's also known as a paw pad keratoma. And it's a focal area of hyperkeratosis. And this means there is excess keratin there. And excess keratin causes thickening and a hard pad. So what is keratin? Keratin is a structural fibrous protein that's found in the skin, in horns, nails, and scales, and gives it these structures its strength. So we look at corns themselves, this hyperkeratosis, we can see that they come up in a variety of presentations. The first picture on the left, you can see a little central dark spot there. And if the picture on the next picture, the middle picture, there's a very obvious circular lesion there in the center. And in this right-hand picture, you've got a large horn-like mass just at the side of the pad. These are all different manifestations of corns. So let's look at the clinical signs. Obviously, the most typical clinical sign is lameness. This is markedly worse on hard ground. And if these dogs exercise on grass, they can be almost lameness-free. The other clinical sign that I see in my surgeries, these dogs will come in and they'll often hold the foot up. They're trying to take the weight off the foot because that pad is sore. Also, these dogs are very depressed. They're reluctant to walk far, reluctant to exercise. And this is most noticeable when they've had their tendon surgery and the corn has been treated. The owners will report back, they've got their dog back to its old happy self. How common are corns? Well, there have been 2 surveys in retired raisers of greyhounds, and these are done in the veterinary practices, and the occurrence is, of all consultations, is 5.9% in one survey, 2.4% in the other. And this is the most common dermatological condition that greyhounds have. But almost certainly this is underdiagnosed, because a lot of these dogs have been diagnosed with having arthritis, and the corns being missed by the vet. So if we look at historic treatments, but before that, if you look at these pictures on the right, you can see this is a micro CT of a corn, of a foot, and you can see this corn here in the center, how that's the normal fat tissue there, and that's a grossly thickened tissue. And this is a corn that's been cut out, and it has this typical central root, if you like, of hard tissue. And this is the stone in the shoe. Topical treatments have been used where you apply all sorts of creams to soften the corn, to burn the corn. And then there's hulling, which is a bit of a vague term, but it basically means digging out the corn to some extent. And this can be more or less all of it being dug out, or it could be incomplete removal, which normally happens. And this will only give temporary relief. And then there's complete excision, as in this case, bottom right. But in the survey that I did, 50% of these recurred within a year. And the reason why they recur is the primary cause has not been addressed. Diagnosis. How do we make the diagnosis? Observation. You look at the pads, and it's pretty obvious you can see a corn. Sometimes there's little to see, as we've already seen. It might help if you wet the area. Sometimes it's just a small black spot. Palpation with your fingers is very important. You get focal pressure if you get pain with focal pressure. If you compress the corn or squeeze it side to side with a pain response. And also feel thickening, palpate the pad medial to lateral, and you'll feel a thickening around the corn area. The differential diagnosis that you've got to be careful of, there might be a foreign body in a piece of glass or a piece of grit. Look at the demographics. These come from 2 surveys that I've done. Breeds, it's almost always sighthounds. I have seen 1 or 2 cases of other breeds. And the sighthound are the racing greyhound, the pet greyhound, whippet, and lurcher. And the reason for this is thought to be because these breeds have much thinner skin and much thinner pads, and this provides less cushioning. The limb distribution is interesting. Approximately 90% of corns occur in the forelimbs. Forelimbs are the main weight-bearing limb. Only 10% occur in the hindlimbs. Pad distribution, approximately 90% are in the central digits. That's digits 3 and 4. And these are the main weight-bearing pads. Age distribution can be anywhere from 1-year-old to old age, and multiple corns. These are quite common. Probably more than a third of dogs will develop multiple corns. That is quite a lot. So if you've got a single corn and you treat it, you must warn the owner that there's a chance that it might develop corns elsewhere. Now, the theories of the cause of corns. The virus has been put around for a long time that it's a papilloma like we get in humans and producers. There have been several studies on this. One study reporting 2 cases, but no others have been found. Richard Doughty looked at 100 corns by PCR and he found no papillomavirus at all. Foreign body penetration, study that I published at 40 corns, none were found. And Richard had looked at 1,000 corns or over 1,000 corns by histology. He's not found any either. However, 4.5% of these had secondary penetration. And this is invariably sort of plant material. And this is because the center of the corn, that black spot, is very soft. And with the dog walking outside on rough ground, plant material can work its way into the corn. However, that says that foreign body penetration, or having a foreign body in there, says this isn't the cause of the corn. I would say that some corns develop as a sequel to penetration. If the glass has been removed, they can go on to cause corns. Then we've got the mechanical theory, which is accepted now. In man, you see corns from external pressure, tight-fitting shoes, and also anatomical abnormalities, thumb and toe. In Sighthounds, paper that I published, 40% had some form of abnormality, but most were insignificant. The only ones which really were significant were digital amputations, if there was a stump and the pad was pulled over the stump, or if you get hyperflexion of the P1, P2 joint. This is the top picture on the right. You can see this joint is really flexed almost at 90 degrees, whereas that normal joint is not, it's about 45 degrees. And that's due to contraction of the superficial flexor tendon further up the leg, and it's been damaged at some time and it's healed and contracted. Or you get fractures in the in P3, third phalanx, the last bone where the nail is. Here you can see a fracture of the flexor process, and that causes abnormal weight bearing. And as we say, we get overrepresentation of the forelimbs and the digital pads 3 and 4, and these are the main weight-bearing pads. Okay, so the mechanical theory evidence. There are 2 papers which give good evidence. One is Professor Swain. He tried injecting silicone gel implants, and he found that the cord regressed because he altered the cushioning of the pad. In my study, I had 2 corns that had distal amputations beforehand, and I did cut back the bone a bit more, pulled the pad over the stump, didn't take the corn out, and the corn disappeared. So the theory is, if the pad is unloaded, then the corn will exfoliate. In other words, it grows out. And it takes about 8 weeks to do that. If we look at the anatomy now, you can see that the 2 flexor tendons run down the back of the foot, and they split into the superficial, which attaches here at the top of the second bit of bone, just below the knuckle joint there, whereas the deep runs down to the bottom of the foot and attaches to the flexor process on the P3 bone, third phalanx, where the claw is, and that is down here. There we are. If you look at the anatomy of the superficial digital flexor tendon, the dog here has had the surgery and had that bit of that tendon removed, And on the right, the top arrow, you can see where the incision was made through the tendon. You can see with the dog that the knuckle in the middle is dropped on that toe, and the toe extends forward, and the nail is in contact with the ground. Now, the reason why that toe doesn't collapse completely is because the deep flexor tendon is still intact, and that holds the toe in some degree of flexion due to the annular ligament, which you can see with the bottom arrow, the bottom circle on the right. The anatomy of the deep digital flexor tendon, as we said, is slightly different. And the tendon inserts on the bit of bone at the back of the claw. And when that's cut, it causes the nail to stick up in the air, and also it'll cause the toe to drop. If the dog has had both tendons cut, the toe will be flat on the ground, but if it's had just a deep tendon cut, then there will be a slight degree of flexion in the toe. So I'd like to just talk about my journey in developing this technique. The first tenotomy was done in June 2018, that's 4 years ago. Since then, I've done over 500 cases. So we originally started by cutting both tendons, the superficial and deep, under the foot. And you can see the incision is made between the large pad, the metacarpal pad at the back, and the digital pad cut down onto the tendon, and the tendon is isolated and cut. And the picture on the left shows the effect when the leg is held up in the air in extension, the nail sticks out. This dog has had a full tenotomy where both the superficial and deep flexor tendons have been cut. That causes the nail to stick up and the toe to be flattened. Aesthetically, it doesn't look particularly nice because that nail sticks up, but it doesn't bother the dog that much. It does work very well, but for it to work well, it needs the support of the adjacent digits. In other words, there mustn't be a missing toe there, there must be a toe that's been amputated on that foot, and you can't do the surgery on more than one toe or on a toe adjacent to another toe that's already had the surgery. If we now look at the superficial digital flexor tendonectomy procedure, you'll see this dog here has had both central toes done, and they both collapse a little bit and stick forward. This was originally performed when it wasn't suitable for doing a full tenotomy, as described in the previous slide. And so it began as a tenotomy, which just means cutting the tendon, doesn't mean taking any out. And this worked very well, but there's quite a high incidence of corn recurrence further down the line after several weeks, months, or even years. And that was due to the tendon rejoining and then contracting down, causing the corn to occur again. So to overcome this problem, I then went for a tendonectomy. And the tendonectomy actually means removing a little piece of tendon. And in this case, it was normally about 1 centimetre, sometimes a little bit more, sometimes less. You take out as much as you comfortably can. So we get the dog ready for surgery. The assistant holds the foot like that and extends the toes. And you can see that makes the tendons stand out. You can see them under the skin very clearly. And you can also see a big blood vessel running down here. Make a small incision over the tendon, and that immediately exposes the white superficial digital flexor tendon. So that is then isolated. these curved artery forceps are pushed underneath it. And if you wiggle them back and forth, you can free quite a bit of tendon, and then that bit of tendon is cut out. The skin is then sutured, and that's it basically. The aftercare is there is a dressing put on, and that's just to prevent any swelling, any bleeding. I advise that to be removed after 24 hours. I also advise the dog to be kept on the lead for 7 to 10 days. And because I use absorbable sutures, I don't normally bother to have them taken out, and they will disappear in a few weeks. So if we can look at the results of both surgeries, and we're looking at in this first paper, we had 100 dogs, 161 corns. The combined tenotomy under the P1 bone was 113 cases, 113 corns. The superficial digital flexor tenotomy was 48 corns. The corns were not treated in any of these cases. They weren't pared back or anything. And at 8 weeks, 95% of the corns to exfoliated, they weren't present. And look at the short-term outcome. We've got the combined tenotomy there and the superficial tenotomy there. And if we spoke the owners at 7 days, you can see there was either a moderate or marked improvement in almost all the cases. When we go to 8 weeks, the 8-week follow-up, and again, this is repeating there. There was no lameness in 84%, 73% of cases, and only slight lameness in the others. There's 3 cases that respond to surgery. So both techniques were equally successful. And now I want to talk about the complications of superficial and deep digital flexor tendinotomy at P1, where both tendons are cut. We've obviously got minor ones, which are common in any surgery, a bit of hemorrhage, a bit of infection. But the major one is hyperextension of the P1, P2 joint. And this is where this knuckle joint is overextended, where the toe bends upwards. And that causes the underside of the joint to press down on the ground, and it's very painful, and it can cause this callus there. The treatment for that is to arthrodese or fuse this joint so it's not in contact with the ground. And the other major complication is the tendon rejoining, and again, revision surgery is needed for that. Now, complications of the superficial tenotomy or tendonectomy, again, the same minor complications, but the major ones, the only major one is either no improvement after the surgery or corn recurrence further down the line, and a revision tendonectomy is undertaken. And this picture here shows a revision tendonectomy where the tendon is rejoined, and it's obviously very thickened, but taking the whole lot out will usually solve the problem. So revision surgery, 25 corns, 22 dogs, and you see the initial surgery was either have the full tenotomy, P1, 3 cases, the superficial tenotomy, the original, 13 cases, superficial tendonectomy where it's removed, 7 cases, and superficial tendonectomy revisions been operated on to cure the problem has failed twice. The revision surgical sites are either going under P1, cutting both tendons, or as you've seen, going into the metacarpus, metatarsus, and cutting out the fibrous tendon. Now, site selection, I think you need to avoid previous scarring, fibrosis from surgery, previous surgery, and if in any doubt, do a complete tendonectomy of both tendons under the foot. The time from initial surgery to revision can vary. In this case, is anywhere from 3 years to 30 months, 3 months to 30 months. And in these dogs, the dog that was 30 months, this dog was cured from the corn and it came back in that length of time. Okay, let's go to some frequently asked questions. First one is, can more than one corn have the surgery in one session? And I say yes, all corns can have the surgery in one surgical session, as it's such a benign procedure and not painful at all. What's the largest number of corns that I've seen? I've seen one dog that's had 7 digital pads affected, and these were treated in 3 surgical sessions, and they were successful. However, dogs like this start to get dropped feet a bit, and they're always a little bit tender afterwards. This is my own dog. She's 11 years old. She's had a toe amputated. These 2 central toes, the superficial tendon has spontaneously ruptured in them. This is an injury which can occur. And so these toes are dropped. And she gets around okay. She's slightly tender on rough ground because the skin underneath is in contact more with the ground. And the final question is, will tendon surgery increase the risk of more corns on that foot? There's no real evidence of this at present, and it appears to be that the same risk is the same as corns developing on the feet. However, I suppose because it increases the weight bearing on that foot, there may be a slight increased risk, but it is low. Well, thank you, and I hope you enjoy the rest of the seminar.
Okay, everybody. Sorry about that. I was supposed to introduce him. That was Mike Guilliard. He's been involved with greyhounds throughout his professional career and has published extensively on their injuries. In 2012, he became a fellow of the Royal College of Veterinary Surgeons by thesis entitled "The Nature, Incidence, and Response to Treatment of Injuries to the Distal Limbs in the Racing Greyhound." He has also received the prestigious Simon Award from the BSAVA for outstanding contributions in the field of veterinary surgery. Next up is Pippa Williams. She is a surgical resident at the private referral center near Cambridge called Dick White Referrals. Pippa is collecting the data for a research project looking at outcomes after corn surgery in both the short and long term to try and determine how the surgical technique SDFT tendonectomy affects sighthounds with corns. Pippa first got inspired to begin corn research by the frustrations of her own dog, a little whippet called Oscar, who suffered from bilateral corns and greatly benefited from the procedure. Pippa will outline the current research project and early results the team have discovered.
Hi there, so my name's Dr. Pippa Williams. I'm really sorry to not be able to be there in person today, but I'm going to talk to you about a prospective corn trial that we've been running since March 2021, and that's looking at the long-term outcomes of the SDFT technique. So why do we need to do a study at all? Well, in veterinary medicine, we like to have evidence in order to recommend a treatment, especially if that's a new or recently described treatment. We need proof that it actually works rather than just word of mouth and someone saying it's a good idea or a good technique. And particularly with corns, there's so many techniques described on the internet and the recurrence rate is really high. For instance, my own dog, who's pictured at the top of this image, had corns, and some of the things I found online included surgical excision, curetting or scooping out of the centre with dental elevators, laser therapy, duct tape, emollients and cream, padded boots, and I tried many of these on my own dog. Some of them did work temporarily, but ultimately recurrence was the big issue. And we know from a previous paper written by Mike, for instance, that the recurrence rate for surgical excision is about 50%. So we need to prove that this technique works, and not just in the short term, but later down the line. For instance, we know that we're altering the weight bearing of the affected digits. So how does this affect the future of corns? How many dogs go on to get corns in other digits or in other feet? And another important reason is to avoid bias, and that's why we're running the study through the University of Liverpool. You might ask, why can't vets just call up owners and ask if it's worked? But some people, for instance, if asked by the person who carried out the procedure, may be overly positive in order not to hurt their feelings or expectations, or may not answer at all if it hasn't gone well. So we need to separate out the person conducting the treatment and the results seen in order to get accurate, non-biased data. So this is a prospective cohort study, and a prospective study means the idea and methods are set out at the beginning, and a group of subjects are recruited and observed over a time period to gather information and record the developments and outcomes. So we're aiming to look at subjects at day 0 before they've had the surgery, and then at 12 weeks and 12 months after surgery, which we've termed medium and long-term follow-up. Now, this long time period is key so that we can establish what side effects there are. Does the surgery really work? And what is the long-term recurrence rate? We need a way of being able to quantify this. How much better actually is the dog? So the way we do this is a validated questionnaire that can then be compared at different time points. So we chose to use the Canine Brief Pain Inventory, which was created by the University of Pennsylvania. And that's a tool to assess the severity of chronic pain and how that pain interferes with the animal's normal function. We can compare the scores from that the dog receives at different time points. So we can compare before the op, when he or she is struggling with the corns, and then post-op in both the median term at 12 weeks and long term at 12 months. So what does the study involve? Well, it's roughly split into 3 parts, with the most important being the questionnaire. Now, this is a short survey which is sent out to people whose dogs are due to undergo corn surgery with the SDF technique and who are keen and consent to be involved. It's emailed out to them, and it's nice and short. It only takes about 5 minutes to complete. And it starts off with some basic questions like which leg is the dog lame on, any other issues the dog may have, how long the corns have been present for, if any other treatment methods have been described. Then the Canine Brief Pain Inventory comes into play, and it asks questions like how bad is the dog's pain level over the last 7 days, and gets the owner to rate that from 1 to 10. And that has different subcategories for at its worst, at its best, because we know that the pain of corns is not the same all the time. It does change according to activity level, what surface the dog is walking on, etc., etc. And then it also asks about how that pain interferes with the dog's life. So does the corn or corns, if they're multiple, stop the dog being able to run? Does it stop them being able to enjoy life? And then last of all, with the Canine Brief Pain Inventory, it comes onto a very important question regarding quality of life. So we all know that most importantly, we want our dogs to enjoy life and we want them to have a good quality of life. So this asks the owner to rate how good they think their dog's quality of life has been over the last week. Now, part number 2 is some pictures of the underside of the feet. And this is hopefully so we can document what happens with the corn over time, as well as what happens with the dog's lameness over time. So here are some nice pictures. You can see this is one of the dogs from the trial. On the left is the pre-operative picture with a nice juicy corn present in the pad. And then this is the same dog at the 12-week mark with no evidence of a corn seen. And these are photographs provided by the owner. Now, finally, part 3 is quite self-explanatory. It's some videos of the dog before the surgery and then videos again afterwards, at hopefully both the 12-week and the 12-month mark. Now, we aim to get vets to grade the lameness in these videos on a scale out of 10, and the vets are going to be blinded. Now, what that means is they're not going to know if the dog is a preoperative patient or one that's at 12 weeks or 12 months. So that hopefully that, again, doesn't bias their data. So I've got a video here. This is one of our first patients that we recruited in the trial. And this is a video of him pre-surgically. And he's a lovely little greyhound called Hagar. And as you can see, he's really quite lame on that front right foot. I'll play that again for you. And then we skip on to a video that was sent by his owner a whole 12 months later. And as you can see from this, he's trotting along quite happily. And it's quite obvious that he's improved quite a lot. And this really must have an impact both on his and his owner's lives. So being able to go out and about and enjoy life and do what we all want to do with our dogs. So how many dogs do we need for this study? Well, we're aiming for about 139 initial recruits, and that figure is based on a power analysis, assuming an approximate recurrence rate of about 5 to 10%. We started collecting data in March 2021, and we'll continue to recruit new cases, as many as possible, up until the end of this year, so the end of 2022. We'll then be analysing the data and collecting the follow-up data until the end of 2023, with the aim of publishing all of these results in 2024. So it is a long project, but the outcome and the amount of data and results we'll have at the end of that should really be worth it. And this study has inspired some other research, which Carl and Ethna will talk to you about next. Now, at the moment, the project is for approved centres only, and that's because ethical approval has to be granted, and we want to try and keep everything as replicable as possible between centres so that the results can be accurately compared. But we do have centres across much of the UK, so in Liverpool, in Cheshire, in Bristol and in Cambridge, and we also have some centres involved in Australia as well. So how are we getting on so far? Well, with any of these things, survey responses are hard to get. People are busy and they do forget, but we're doing very well initially, and we've got 109 dogs that have been recruited. And of these, 91 have responded to the initial survey. And this will really give us a lot of information about which digits and which limbs are affected, how painful the owners perceive the corns, how they affect dogs' lives. We then look at the follow-up data, and this does get even more challenging with time as people forget to fill in surveys. And obviously a lot of this data is still ongoing as well. A lot of dogs haven't reached the 12-month mark yet, but we have had 46 responses to the 12-week survey so far and 9 to the 12-month survey. So early findings, generally everyone is really, really happy and positive about the technique. You know, these are people that have suffered with their dog's lamenesses for months, maybe even years, trying lots of different things, just like I did. And I'm really lucky that I get some really lovely emails back with how happy people are that they had their procedure and that their dog is more comfortable. Now, we originally only wanted to recruit dog with only one limb affected, so unilaterally, because we thought that would be easier to compare and analyse the data. But we did find out pretty quickly that the epidemiology of the disease doesn't really seem to fit with that. And it seemed that most dogs have both front feet affected, or both feet, usually front feet affected. Or if they've had one foot affected, then with time, the other front foot would also become affected. Now, it's very hard to say if this is because of the procedure or whether this would have happened regardless because it's a bilateral disease process. So I guess that's where more research into the biomechanics is needed, and Carl's going to come on to that next. Now, importantly to note, if a corn did appear subsequently on another digit or another limb, repeat surgery, it did seem that the same good outcome could be achieved. Okay. Now, there's lots of later data still to be collected and obviously all the stats to be analysed, but keep your eyes peeled for the full results, hopefully in 2024. We're really looking forward to that. Thank you very much for letting me be involved in this presentation today. It's really exciting that everyone can come together like this. I'm really happy to be a part of it. If you have any questions, I'm sure Ethna and Mike can share my email and I'd be happy to answer those. Thank you very much.
Okay, that was Pippa Williams. Next up is Dr. Carl Bates. He is a biomechanics researcher at the University of Liverpool. He uses experimental techniques like motion analysis alongside computer modeling, approaches like evolutionary robotics to study how and why animals move the way they do. In his talk, Dr. Bates will outline the approaches the team plan to use to quantify the motions and internal forces of movement in greyhounds suffering from corns both before and after surgical intervention.
Good afternoon or good evening, depending on where you're joining us from. My name is Dr. Carl Bates. I'm a biomechanics researcher at the University of Liverpool. And I'm going to speak on behalf of not only Mike and Philippa, who you've heard from already, but also a colleague at Liverpool, Professor Ethna Comerford. By this point, Mike and Philippa should have outlined the terrible long-term effects on quality of life that corns have in greyhounds. You may have been familiar with that already. And also, they'll have told you about this relatively new treatment, superficial flexor tendonectomy, that has been used recently to try and treat corns in greyhounds. What I'm going to outline now on behalf of the four of us is what we'd like to do next, and a plan specifically for a PhD project that we'd like to get support for at the University of Liverpool that will use quite cutting edge experimental biomechanical methods, so things like motion analysis, and also computational methods borrowed from the field of engineering to try and assess the long-term impacts on greyhound musculoskeletal health after superficial flexor tendinectomy treatment. So what I'm going to do in the next 15 minutes or so is give you an overview of that PhD project, starting with an overview of our facilities at Liverpool and the methods we'd like to use in the project, and then I'll build towards the actual plan for the new project. So we're very lucky at Liverpool that we have some very nice facilities. This is our main gait lab. It's around 20 meters long on that axis and about 15 meters wide here, and it gives us plenty of room to collect lots of different types of data with lots of different kit. So we have a 12 camera motion capture system, so you can see these little cameras dotted around the ceiling gantry system there. And these are the same types of system that they use in the movies to collect special effects data. So you might have seen, if you've seen the making of any of the Avengers films or Star Wars films, you'll have seen the act covered in reflective dots. And that's what these cameras do. They collect data on the motion of those reflective dots that you can place across the body of your subject to get information on how their joints move as they walk or run through the lab. We have force plates embedded in the floor of the lab, so we can collect data on the forces that are exchanged between the subject and the ground as they walk or they jump or they run. We have a nice piece of kit here for measuring muscle strength or the strength of muscle groups in humans, obviously, not in animal work. We have various sensors for measuring when muscles switch on and off, so we can match the motions to the muscles that are driving them. And we have instrumented treadmills that measure the forces or pressures under the feet of human or animal subjects as they walk on the treadmills at controlled speed. And so the kind of data we get in this lab looks a little bit like this. So you can see here in the animation in the left, the human skeleton is being animated according to the motion of the green spheres that were attached to the subject, those reflective dots that you might have seen as they walk through the lab. And we can use the movement of those dots to estimate how the different joints are being rotated as someone walks through the lab. If they walk over the force plates at the same time, you can see the forces between the foot and the ground that are being encountered. And as I say, if we've got the muscle sensors on there as well, we can integrate information on which muscles are activating at different times to actually realize these movements. Now this is all very nice, but of course when we measure movement in animals or in humans, we're interested in the movement of the bones, as you can see in that left animation there. But if we're sticking markers to the skin and sometimes even on to clothes above the skin, then that's only a very crude approximation of how the bones are moving, because obviously the bones are under the clothes, under the skin, under the muscle. So it's an approximation of how those bones are moving. If we want more accurate information on how the bones are moving, we're very lucky at Liverpool. We're one of 3 institutions in the UK to have what's called a biplanar X-ray system. And this is essentially 2 X-ray units with high-speed video cameras in them to actually image X-rays as a human or an animal moves through the X-ray zone. And with this technique, it allows us to measure things that it's just not possible to measure with other techniques like the surface marker technique that I showed you before. And the best examples I can give you of this that are directly relevant to the Greyhound project that we're proposing are human hands and human feet. So human hands and human feet, just like Greyhound hands and feet, are full of lots of little tiny bones that you just can't put surface markers on the skin to measure the movements of. But using X-ray videos like this and reconstructions, 3D reconstructions of the bones from CT scans, we can actually image and reconstruct the movements of all these tiny bones with incredible accuracy. So some accuracy tests by researchers at Brown University in the USA have estimated that these techniques are accurate to within 0.1 of a degree or 0.1 of a millimeter. So super, super accurate. Here we've got a subject rotating their wrist, and this subject will later undergo a wrist replacement, and we can compare how the mobility of the wrist was affected by that wrist replacement, which again is quite a parallel example to the Greyhound study that we want to do to investigate the effect of corn treatments. Similarly, we can do this with feet as well. So this is my foot, you can see in the X-ray video on the left. And we match reconstructions of the bones to those to accurately quantify the movement of all those tiny bones at high speed. Now at Liverpool, we don't just measure motion. We also want to understand how that motion is created and how it relates to the anatomy or the morphology of the animal. And we do that through something that you might call image-based biomechanical modeling. So we quantify the anatomy of the animal, and this is a human leg. This is my leg again as the example. So we can CT or MRI scan our subjects and produce 3D reconstructions of the bones. We can reconstruct the 3-dimensional size of the muscles overall, and then we can even image the fine scale microscopic architecture of the fibers. And what we can then do with that information is we could just do simple tests to correlate differences in motion with differences in anatomy between subjects, for example, depending on the question we were interested in. But if we wanted to really get to grips with how the anatomy is working when it moves, we can build these biomechanical or physics-based models. And you can see here that all the muscles in my leg have been reconstructed as approximate lines of action. And then with mathematical models that take this information on how the muscles are built and convert that information into forces and powers, we can actually simulate the motion using basic physics simulation to estimate how the muscles are working to perform a particular action. And most importantly of all, we have to validate those methods, and we've done a lot of work on validation at Liverpool. So for example, this is a simulation of me on the strength tester here, and in the real experiment I'm trying to move my ankle with as much force as I possibly can, pushing against this very clever strength tester, and then we simulate that motion with the model, and we can see that the blue and red lines here closely approximate the black line, which is the measured data. So we can say that our model is accurate to within a few percent, and we can then use that model to answer questions about how I move, for example. And one example of that we're doing at the moment is to look at why it costs some human beings more energy to walk than it does with others. And we've collected the kind of data I've shown you on previous slides on lots and lots of people, and then built lots of these models and simulated their motion as they walk through our gait lab. And what we've been able to show is that differences in the anatomy, so the relative lengths of the thigh up here and the lower leg down here, correlate with how muscles in the thigh are used, how much energy they use to walk, and how the knee joint is used when we walk. And those things are a really good explanation of why it costs some people more energy to walk through a room than it does others. To pick a more clinical example that's directly relevant to tendonectomy in greyhounds, I've gone back 15 years just to give you an idea of how long people have been doing this in humans. And the example I picked is a very famous example about treatment for gait abnormality in cerebral palsy. So as you may be aware, patients with cerebral palsy suffer from this pathological stiff knee gait, where they seem to almost drag one leg a little bit and their knee doesn't really bend in that leg when they walk. And that's caused by abnormal activation of the rectus femoris muscle in your thigh. So that if you run your hand down the front of your thigh across your quads, that muscle that you're rubbing is your rectus femoris muscle on the front of the thigh here. So abnormal activation of that muscle causes that gait. And there were two ideas about treatment for that condition in a specific patient, in a child with cerebral palsy. The first was to intervene with that muscle by injecting it with a Botox injection. Now, obviously, if you were to do that, it would essentially knock out that muscle. It would be the same as cutting that muscle out, if you like. And that would affect every joint that muscle crosses. So it would affect, you can see here, it crosses the hip and it crosses the knee. So disabling that muscle completely would affect both joints. The other alternative was to actually surgically relocate that muscle. So to take it off, take its insertion away and put it higher up in the leg so that it no longer affected the knee, but could still do its job at the hip. So what these researchers decided to do was to build a computer model of the patient, and essentially with a computer model you can relocate that muscle digitally, or you can switch it off completely digitally, and you can see what effect it has on the model, and perhaps it might have a better effect in one version of the model than the other, and that might tell you which surgical scenario is best to go for. So that's exactly what they did. They simulated with a Botox injection and with this transfer of the muscle to higher in the leg so it didn't cross the knee. And there's their simulation there as an example. Now this is quite a complicated graph, so I'll try and explain it clearly. So the dark shaded grey band that you can see is healthy human knee movement. So that's how humans typically bend their knee when they walk. What you can see on here is that before the operation, the patient suffered from this stiff knee. So it didn't bend, the patient didn't bend their knee as much as a healthy human before they had the operation. The two versions of the model are on here. So B here is this relocation of the muscle above the knee, and A here is the Botox injection. And the model predicted that the Botox injection wouldn't have as much effect as the transfer of the muscle would. So they decided to go with the predictions of the model, and they went for this rectus femoris transfer rather than the Botox. And what they found was that the patient did indeed significantly improve their knee flexion, or how they bent their knee during normal walking, and it was much closer to prediction B, the correct model, than prediction A. So we've known for a very long time through human studies that these biomechanical experimental and modelling approaches can really help evaluating surgical interventions. And also the benefit they also have is that they don't just tell you what happens to the little bit of the system that you're interested in. They can tell you about the whole system, because we're modelling the movement of the entire human body. So they can potentially tell us something about side effects or trade-offs that might occur after a surgical intervention. So the obvious question here today for us when we're talking about greyhounds and dogs generally is, why not apply these methods to dogs and to veterinary welfare problems in dogs? And it's a shame really that the veterinary side, the veterinary application of these methods has lagged a long way behind the human clinical side. And that's something we've been trying to address at Liverpool in the last 2 to 3 years. So we've been building up very large data sets in our biomechanics lab of both the anatomy of dogs and the way they move, so that we can understand how different breed conformations move in different ways and what effect different proportions of the skeleton have on the way these animals move, and what that might have to do with certain prevalent issues that occur in some breeds and don't occur in others. We've also been looking at other welfare issues related to working dogs. So working dogs in the police and military, for example, have to carry loads on their back. We've been trying to address what the best way of carrying those loads might be and what an appropriate maximum magnitude might be. So we've got a dog here carrying weighted bags and another dog here carrying weights in a tube. And we've quantified the effect it has on the way different joints move, like the shoulder and the knee, and you can see differences at the knee but not so much at the shoulder here in this particular dog. And of course they're walking across the force plates here. You can see the red arrows, so we can look at the forces going through the limb as well at the same time in the different conditions as they carry different weights. We've also been using our X-ray system to look at optimal design of implants in dogs. So you can see just at the end here, you'll see knee implants in this particular dog, and this is a massive financial burden on owners, and it's a huge veterinary issue, particularly cruciate ligaments in breeds like Labradors. So we can use these methods to quantify the effect that a certain design of implant has on the way the dog moves, and how that might correlate with failure rates in different implants and things like that. Taking that one step further, we can then build these biomechanical models and try and predict the forces that the joints and the implants are being exposed to in the dog. So this is an example of West Highland White Terrier gait and modelling. And here we're interested in the hip and optimal design of implants or hip replacements. And so by predicting the forces that are going on in here, we can say something about how the implant needs to be built to sustain those forces. And with this background in methods that we've been, and experience as well, I guess, that we've built up over the last 2 or 3 years, we'd like to focus that now into a project looking at this newish treatment for corns in greyhounds, superficial flexor tendonectomy. And I'm just going to give you a sort of brief overview now of how we would plan to do that if we can get enough support to get this project off the ground. So I've said a lot about the methods already, and phase 1 of the project would involve collecting the experimental biomechanical data with motion capture, pressure mats to look at the distribution of pressure under the foot that's affected by corns and compare it to healthy greyhound pressures, and then X-ray analysis of the bones in the hands and the feet. And we'd look to do that basically straight away. That's where we would begin in the project. What we would look to do is to basically follow through a cohort of greyhounds that are affected by corns and that undergo this procedure. And we would collect this force and motion data on them pre-surgery and then follow them through in three periods of time, after 6 months, 12 months and 24 months post-surgery, to see how their gait is progressing over that period. And with all types of studies like this, you always want a control group. So we'd also look to study a cohort of greyhounds at the beginning of the project and then get those healthy greyhounds that aren't affected by corns back in at the end, so that we have a healthy control to compare these animals to that have undergone the procedure. And then phase 2 would be to input all that data into computational models and essentially model healthy greyhound locomotion over a 2-year period and compare that to locomotion in the surgical group, to look at how the hands and the feet are being affected, but also the whole limb generally, the whole gait of the animal, to see if there are any trade-offs anywhere else in the limb that we might need to be aware of. That's really all I want to say about the project. I'll be around for questions and I'd be happy to talk in more detail about any of this work. Thank you very much.
Okay, that's the last of the videos. I'm going to pass things over to Joe Blake, our Great Britain representative. I want to thank her for all of her help in bringing this together. She's helped put this together, and I'd like to also thank Dr. Cotto, Dr. Guilliard, Dr. Bates, and Professor Comerford and Dr. Williams for making this possible. I'll leave it up to you, Joe.
Thank you. So yeah, just to pick up before we go to the live Q&A, the chat's been very quiet, so maybe you've all had the information you've needed, or maybe you're just sort of stunned into silence, but we have had a few questions come through in advance, so there are a few questions, but if anything comes to mind, do pop it in the chat box, or if you're feeling brave, you should be able to unmute yourselves later in a second to take part in some discussion. But obviously we wanted to say a huge thank you to you all for joining us, for supporting firstly this event, but also to help us raise funds for this really important study. We've got a great mix of people here for this session, from veterinary professionals, manual therapists, people from charities, volunteers and staff, and of course lots of sighthound guardians and owners as well. So thank you. The session is being recorded, so you will get a recording of it over the coming days. There's a lot of information there to take on board, so if you want to revisit it, you'll be able to. It will also be available for others who perhaps couldn't make it today to be able to make the same donation and watch this information. So please do spread the word. And we're hoping to do more events like this. So if you've enjoyed it, please do let us know. If you've got other feedback, I know we've had some technical issues, please again do drop us a line. And if there are any particular subjects you'd like to hear about, then let us know and we'll see what we can do. Of course, again, just to reiterate, thank you so much to our speakers. This evening, wherever you are today, has been possible really because everyone's been happy to donate their time and their expertise. So you know, we're all here for the good of sighthounds. Ultimately, we know what a misery corns can create, mainly for the dogs, but also for their people and their families, trying to give them the best life that we possibly can. So you know, as I say, every penny goes towards supporting the study that could be so important to look at the long-term outcomes of these procedures for dogs. So if you're able to make a further donation, please do. But as I say, please do spread the word, and let's get more people clued up on corns and helping to progress the treatments. So I'm going to hand back over to Mandy. We've got our live Q&A session now with Dr. Guilliard, Dr. Bates and Professor Comerford. So if you do have any other questions, I can see some bits going into the chat box now, which is great. Let's crack on with the Q&A session.
Thank you, Joe. So I'm going to introduce Trina again. She is part of our board, and she's going to read out the questions so far that we have for the group to answer.
Okay. All right, so we've been getting a few questions here in the chat. I will, most of them, some of them are actually asking how veterinarians in the United States can get this procedure, and can they? I can let everybody else answer it too, but I will speak from experience that there is a list on the Greyhounds with Corns Facebook page of all the veterinarians in the United States that have done this procedure. And it is updated a lot, and it's actually just on that Facebook page. You can download it. It's an Excel spreadsheet, and it has anybody that's ever done it. I'm in the United States, and I have 2 dogs that have had it done. So it definitely is available here. You just have to look there. But I don't know if any of the panelists have anything additional to say about conducting in the United States.
No, I think I know Mike is here as well. So I think a lot of these questions. Hi, my name's Ethna. Thank you all very much for attending the symposium, and for Trina and Mandy and Joe for doing such an amazing job in organising it all. So thank you all very much. I know Mike is here, and I think a lot of these questions, he's probably the best person to answer. I'm certainly happy to support, but I think he's the guru really. In terms of US, I don't know, again, I defer to Mike. In terms of the legality of that, I'm not sure.
Is he online?
Yeah, he is.
Sorry.
He's
Yeah,
there.
I'm sorry, I'm not very
Okay.
technical on this. Can you see my picture? Am I there? If I
No,
You're there.
You're
I'm
here.
there.
We can't see you. We'll be
You
okay.
can't see it. Do you want to see it? Perhaps
That's up
not.
to you.
Always.
Okay, let's see. I don't know what I'm doing here, but I can hear you and whatever. So just ask the questions, please.
All right, so I'll kind of start from the top. I've been trying to catch them as they come through. One question came in before the discussion from Jennifer Jones. She says, my 10-year-old gray has corns on 2 to 3 pads on all feet. Could you advise if flexor tenotomy is appropriate in this situation? And if so, what is the recovery process and period?
Well, sorry, how many corns?
She says 2 to 3 pads on all feet.
Well, what I recommend now for this is if the dog has a corn, it should be operated on and should have the tendonectomy. I think they benefit greatly from it. And as I said in the talk, I think the more toes that are affected, I think the outcome will be perhaps not quite as good eventually, but I don't know. But the dogs certainly improve a lot in the short term. So I always say go for it, but only operate on the toes that are painful. You can always come back in and do other corns in the future. So I hope that helps. And again, the recovery with all these corns is very, very rapid. And the great thing about this surgery is it's not painful at all. These dogs don't really need painkillers afterwards. They have no pain from the surgery, or very little. It'll be maybe for a day or two and then that's it. So I hope that helps.
All right, the next one is, from Gray Schism, could a changed gait from a previous injury increase the risk of corns? My hound had a severe injury requiring partial orthodesis of his left hind hock in mid-2020 and started having issues with corns in early 2022.
This is a much more difficult one. It depends how the orthodesis in the hock, especially, it will certainly alter how the dog ambulates on the feet. And it can be difficult to deal with. What can happen with these, certainly with hock surgeries, not orthodesis particularly, but for other surgeries of fractured calcaneus and things like that, or any sort of fractured hock that you get in a racing dog, is you can get damage to the tendons, the superficial tendons, quite often either from the surgery or from the dressing injuries afterwards. And this will cause a contraction of the toes. And if your dog walks with contracted feet, claw-like feet, this can be relieved very easily just by cutting all the tendons. And that has helped a lot of dogs. But I think with some of these corns in these cases, I don't think you can cure. Okay.
Trina, would you like me to pick off a few that I can see? Would that be helpful? And then I'll defer the rest to Mike.
Sure.
If that's okay with you.
Yeah, go for it.
If because I can just see them right in front of me, and then I'll defer them to Mike if that's all right. And to you and Mike. So in terms of Sarah, thank you for your question, Sarah. The surgery is something your own vet can do. Well, Mike has done 500. So yes, I think we're using it. So I don't think you would call it as experimental. Again, it depends on the legalities in the States. So I know there's first opinion vets doing them in the UK. Would you agree with that, Mike?
Yes, definitely. I mean, there's now a lot of information out there on how to do the procedure. And an article has just been published by myself in Veterinary Dermatology, which any vet can get hold of. And that goes through how to do the surgery. So it's all out there. So
from Sarah then, just if that's okay, Trina, just because I can see the ones that I can do, and then we can give the meeting one to Mike. The articles Mike has intimated them and they've been published, so I'm sure we can give you the PDFs of those that Trina can distribute to Sarah. Arthritis for Marina Scotti. Again, I'm interested to hear Mike's take on this. So the superficial tendinectomy alters the load bearing in the treated foot My question is, how does it affect or worsen a hound that already has arthritis in the foot? I don't necessarily think we know, but again, and again, that's part of what we're doing in the study. If Mike was happy to add to that. So a dog that already possibly has arthritis in its foot, Mike.
Well, I wouldn't like to say really. I don't know. I'd have to see the individual and decide what I thought. I don't know how much, what sort of arthritis will particularly affect the foot that badly, apart from maybe possibly the metacarpophalangeal joints, but I need to pass on that.
I think it's higher up, actually. She's just put a correction in there. It's actually, the dog has got arthritis higher up, so I suppose that fits with the weight bearing question, doesn't it?
Yeah, could do. Yeah.
I popped around in those, Trina. So
and I did just drop the PDF of the paper you referenced into the chat, so everyone can grab it from there.
Perfect. Okay. The average cost of the surgery, Stephen, I think it very much depends. If you discuss it between Mike and I, it's probably worth taking a flight over to see Mike. The difference between Mike and Mike. Myself and Pippa would probably charge £400 or £500 more where we are in practice than Mike, but I think it just very much depends, really. We do have fixed pricing. This sort of surgery doesn't necessarily come to us in University of Liverpool, but it is coming a bit more now because we're just getting a bit more of a name for it. I was actually very, very taken by Dr. Kuto's $8,000 and $12,000 corns. Oh my goodness me, that's just would break your heart, actually. So there's a question, Mike, Stephen, again from Stephen. Is there any contraindication for hulling the core in conjunction with tendonectomy to expedite comfort in the 2-week recovery? I mean, Mike can add to this more than me because he's much more experienced than me, but the dogs are immediately better. The corn doesn't need to be hulled. I'll pass that on to you, Mike.
Yeah, I agree with you entirely. Sometimes if there's a great whopping horn of a corn, I'll just spare the top off it, but I certainly won't try and dig it out or do anything else like that because you could make it more sore. Okay.
More vets from Josie. What recommendation would you give to US pet parents who consider the tendonectomy procedure? How can US vets get more info? Again, we can certainly send well, actually, Trina, that one back to you. I'm going to hand back to you now.
Yeah, I posted that PDF of his down there, and I know, like I say, mentioned the very comprehensive spreadsheet on that Facebook page, and we've definitely found quite a few vets that are doing it in here now. I know they've contacted you guys too for more information, and the price varies wildly throughout the United States. So in Virginia, it's probably $800 to $1,000. I would say would be about what it costs us. So, but I'm sure that varies tremendously as you move around the country. So.
Yes, and on our, I just wanted to mention on our website too, we do have a whole section about corns. And so we can post these articles on there and any that we're missing and add to that to give more veterinarians the information that's necessary.
So Trina, I think I've covered, I think it's mostly the ones left there from Cynthia Down, actually, if I hand over back to you.
Okay. Cynthia does ask, how common is a corn developing on a non-weight bearing limb? Her first retired Greyhound had a shoulder surgery and was non-weight bearing for several weeks, and after that developed a corn on one of his toes. I will actually say that happened to one of my dogs too, who was non-weight bearing, and he got a corn on that toe too.
Sorry, for me, is that?
Yeah, Mike. The rest of these are yours. Because there's a fair bit of juice in here, so the rest of these are yours, and I can add in if I can help.
Yeah. So just talk me through that one again, please.
Yeah, no problem.
It's a
non-weight bearing limb due to surgery or injury, and then a corn pops up on one of the toes of that limb.
If it's not weight bearing on that limb and it develops a corn, is that what you're saying?
Yeah.
Well, presumably the corn won't bother it if it doesn't weight bear. If it's
I know.
for another reason.
Yeah, Cynthia can unmute and respond as well, but I can tell you with my dog, we obviously after surgery, we wanted, he did become weight bearing with recovery, but the corn popped up during recovery, so we had to take him back into the tendonectomy about 2 weeks after his arthrodesis. So, so it did develop on a non-weight bearing leg, or maybe oddly weight bearing leg. Maybe that's better.
Well, yeah, I've no idea why it developed, but if you think it's going to bother him, cut it. Cut the
That's what we
tendon.
did.
Yeah, well done.
Yeah, so Cynthia, that's what we did and it worked. So I can just tell you. All right, the next one is I have a whippet that Laura courses and competes in Fast Cat. Would she be able to resume participating in these sports after a bilateral SDF on both front feet? And if so, would she be prone to injuries, or would the likelihood of CCL be higher after SDF? In other words, would weight distribution have any effect on movement when running at top speed and switching directions?
Well, I would think not actually, because I do work on racing greyhounds and they go back to racing very soon afterwards. The second dog that I did was a racing greyhound that had corns on both its front feet, one on each front foot. And I did that. The trainer didn't follow my instructions and he had it back on the track at 5 weeks and it never looked back after that. And it certainly didn't get any injuries from there on. So I doubt if it will cause any problems.
I mean, I would add to that, Mike. I suppose we don't, obviously bearing in mind the dogs Mike's talking about and he's seeing what they're doing long term, they're not developing. And given that we know that greyhounds, well, sighthounds in particular, don't really develop cruciate disease. And I've done an awful lot of work on that in my research. Their ligaments are very different to Labradors in terms of how they're made up. So they've something very different going on. And actually, I think exercise is actually potentially in greyhounds or sighthounds is protective. But again, we don't know. But again, I think this project with Tatiana and Carl potentially is the one we're proposing. I think is something that we can look at with the motion capture, and then potentially with the biplanar fluoro to see what the joints are doing. And that was one of our main interests when I've spoken to Mike about this a lot, but one of our main interests was what are these dogs doing long term? And it's been a really nice collaboration from that point of view, because Mike is the user of it and the developer, and we're sort of testing it out, so to speak. So I think watch this space, which is why we're all here.
Okay, the next one has been covered a little bit, but Nancy asks that her male greyhound has corns on all 4 paws, 1 pad on each. She said he came to me at 20 months and developed them first in front right, and about a year later, at a year later, it went within 2 years, the other paws had already done. What are the chances that corns will just keep developing even after surgery, and how many pads on each paw can have surgery?
Yeah, chances are more corns. Yeah, the chances are more corns can recur. I guess there's a genetic component there, and Richard Doughty's trying to look into this. He's collecting blood samples from dogs which have got multiple corns, and he's looking at the DNA. But you can't predict if they'll develop any more or not. But if they keep throwing them up, my guess is they might throw up some more. But if they do, you cut the tendons and you make them better for certainly for probably quite a good period of time.
And I will say I recognize a lot of these names as they have been participants in the swabs that have been collected for him, because they mail them to me and then I mail them to Norway. So if you've mailed a swab in the last 6 months or so, they are currently in the air on the way to Norway. So your next question is, my greyhound has had what I suspect is both tendons cut on 2 toes on 1 foot. This was done during her racing career. She is still getting corns on both of those pads. From what I have heard today, I wonder if the procedure was not effective because there are 2 toes next to one another were done. Is there anything that can be done for her now that her tendons have already been cut?
What did you have done? Did you have the tendonectomy done on them, or doesn't it say?
It doesn't say. Heather, do you want to unmute and respond?
Yeah, well, I don't know.
I'm actually not 100% sure what happened, because I adopted her after it happened and they weren't forthcoming with what they'd done. But both toes next to one another. They're flat on the floor, as you were describing. And they did say that they had cut her tendons, but they didn't say which procedure exactly it was.
Okay, if the toes are completely flat on the floor and the nails stick up, both tendons will have been cut. And then the problem is that the dog will be walking on the skin underneath, possibly. And this is, you may even be getting this hyper extension of the knuckle joint, P1, P2, where the whole joint, instead of lying more or less flat, sort of bends upwards. And the skin under that joint then is in constant contact with the ground, and you sort of develop a corn on the skin, and that does become a real problem to fix. But you need to have a close look at, under the toes to see what's going on, and I don't think there will be an easy solution for that. I have the dog I showed with that that had this hyperextension, and you could see the callus under the joint. That, in fact, wasn't a greyhound. The toe was, but the callus underneath wasn't. That was a golden retriever that had cut both its tendons on glass, and that toe collapsed completely. And I then fused that toe back into a degree of flexion, and the corn underneath the pad, just underneath the joint, completely disappeared. But it is a very difficult problem to solve. Okay.
All right,
Thank
the
you.
next one, thank you. The next one is from Joe, and she wanted to ask Dr. Bates how easily dogs get used to carrying the equipment to monitor their movement, and does it impact the gait analysis as if they adjust their gait because it feels different to them?
Thanks, Joe. I would say not. So we've done over 100 dogs now in the last couple of years, sticking the markers on them, and they have 44 markers stuck across the body. And I don't think it bothers them at all. Some of them, I mean, it bothers us at times because they like to shake them off sometimes. If you've got a dog that likes to shake, sometimes they fly off and we have to stick them back on. But we've only ever had one dog out of 100 and something dogs where we didn't collect any data because they clearly just weren't happy in the lab generally, to be honest, rather than specifically with the markers that were stuck on. But no, I don't think it affects their movement at all. They're all perfectly happy trotting through the lab, especially if there are treats involved.
All right, and so people are saying they can't see the PDF. You probably have to scroll up to get it. I don't know if anyone can confirm they do see it, but it was up at about 126 when I posted it. I posted it again at the end. So the next question is, after bilateral front limb SDF surgery, lumps at the surgical site were present and the tendons grew together. What should be done?
Sorry, can you just repeat that, please?
Yes, after bilateral front limb SDF surgery, lumps at the surgical site were present and the tendons grew together. What should be done?
Okay. You need revision surgery. If you can feel the thickened tendon at the back of the metacarpus, you can dissect that out. As I showed a picture of a dissected tendon that came from that area, the surgeon can very carefully dissect it all out. There's a slight risk it can reform. The other alternative is to go to the other site, the original site, under the foot at P1, and cut both tendons. And I don't think there's anything wrong in doing that, provided that the toes on either side are normal, we've got normal flexion and everything. So you have a choice. Okay.
All right, next is, do you have plans to partner with a US university to extend the research? And they suggested University of Pennsylvania.
I can take that one, Trina. We haven't. We sort of, on Pippa's project, which is for her ECVS, which is the same thing as or similar to the ACVS diploma. She's doing that as a project for her surgical training and her credentials for her boards. We're almost there with that recruitment, so we haven't paired with anybody, but we're certainly very happy to talk to you, Nancy, if you want to pass on your details to Trina. that would be if you want us to chat to you. I think at this stage, though, we'd have to put ethics in every person we put on for that study. We have to put on our ethics, which takes 2 or 3 weeks. So, so if you have a high caseload and you're doing them, then yes, talk to us. But other than that, we're always happy for people to talk to us and partner.
All right, and next question is, what is a cutaneous horn, and are they related to corns in their makeup and occurrence?
A cutaneous horn, yeah.
Horn, yeah.
Yeah, I don't know is the answer to that. I don't think it's, as far as I'm aware, it's not a pressure problem. I don't know. Don't know if
I don't know either. No.
We're not dermatologists, are we, Ethna?
The last time I looked, but I've got more of a grasp of dermatology than most of my orthopedic colleagues, to be fair, which isn't very much. So that says how bad theirs is.
All right, and it looks like Joe put up another one saying it's generally accepted that nails that are too long don't help preventing or alleviating corn development and discomfort, which links corns to altered weight bearing, as you've discussed. On that basis, is it feasible to assume that dogs with racing injuries who will likely have an altered gait are more likely to develop corns later in life? And could that explain why for some dogs corns return even after surgery?
I don't think that racing injuries particularly cause corns at all. That's in general. Obviously, there might be exceptions. There is one racing injury which you see, and that is a natural tear of the superficial tendon at the metacarpus. And you also see that in pet dogs as well. I see it quite often in whippets, and you can feel a thickened tendon there. And when this contracts later on in life, maybe it can cause a corn. But I can't think of any other injuries particularly that which will cause a corn, unless you get some misshapen toes and altered weight bearing there.
And it's interesting. Mike said that he's hardly seen it in any other dogs. And I saw a dog that came to me a few weeks ago that was a 1-year-old cockapoo, and came because someone had heard it. I've been doing corn surgery and it might be a corn, and I was like, I'm sure it's not a corn, but it did have a corn. So I was a bit concerned that given it was a spaniel, or it had a spaniel in it, as in the part of the cockapoo, which is a cocker spaniel, that it could have elbow disease. So I was really, because it's so highly unusual, I just thought there's something going on here, but it didn't. It had what spaniel elbows had. It maybe had suggestion of that thing called a intercondylar fissure, but probably what you'd see in any spaniel. It looks a little bit altered on CT, but I was a bit nervous about it because I've never seen one, and not that I've seen many, but to see one that isn't in a sighthound. So I suppose leading on to that, I think they do have must have some degree of genetic predisposition in terms of how they load their feet, and so what Mike said earlier.
And also it is familial. You can see families, the sort of the mother and some of the offspring can develop corns. And I think Richard is looking into this as well as part of his research.
It's very interesting. That's really interesting, Mike.
Yes, and a few family cohorts of swabs this time too. So
yeah, that's very interesting, because, well, I'm not sure. I suppose then you could really get down into why that is, within those groups. Very, very interesting. Yeah, really interesting.
All right, and then Dr. Bates asked, Mike, do you see more or less cases in different parts of the country, i.e. city versus rural, where you might expect different surfaces and substrates?
Sorry, different surfaces in different parts of the country, you say?
Yeah, or city versus country, that kind of thing.
No, I don't think that makes any difference at all. No, no, I don't think wherever they walk, I don't think it matters. Okay.
I don't see any more questions. If I missed a question, you can unmute and ask or raise your hand. tried to make sure, and we've put the PDF in there twice again, so hopefully people can grab that. All right, I think that means that everybody's got their questions answered.
Okay,